Hey, everybody. Welcome to Dental Voice with Zyris. My name is Rolando Mia. Today, what we're going to be doing is spending some time to understand the value of information. The purpose of Dental Voice is to bring clinicians content, information from people who are experienced, knowledgeable, and give us actionable advice. Now, the American Dental Association is an entity that has so much to offer, and we don't even scratch the surface of that. We have Dr. Suzanne Ebert, the VP of Operations and Customer Relations with us, and she's going to share with us why it's so important to understand this context of relationships as it relates to building practices, among other things. Good morning, Dr. Ebert. Thank you so much for joining us. It's great to see you.
Good morning. I am very happy to be here. I'm so excited.
I really, really appreciate it. We're going to jump right in. So, clinicians, young dentists, graduates from dental school, even mid-career dentists right now are reeling with so many things that are happening in dentistry. Now, clinical expertise is absolutely critical, but the American Dental Association has basically invested in this resource that you have here and brought you on. What's that all about?
Well, about 4 years ago exactly, the American Dental Association realized that they really wanted to provide a huge value to their members at every single stage of their career. And how wonderful is it that we now have a program called ADA Practice Transitions. And that program helps to place dentists in practices that fit their personal mission, vision, and values, because we all know that if the relationship isn't there between the practice and the doctor and the patients and the staff, it's not going to be a good fit.
So wait, practice transitions. When I think practice transitions, I'm thinking, oh, retirement, giving it to somebody else. Is that what this is about?
There is certainly an element of that. We do facilitate the buying and selling of practices, but the most important thing that we do is we make sure that the dentist gets into the right practice, that we find the right buyer, so that these people who are selling their legacies, their patient base, their staff who have built this practice from the ground up many times, that practice can continue successfully to provide that same quality of care for the patients. And that's what we want.
I think I love the context around that, because people graduating from dental school, or even young dentists who leave DSOs and join private practice, think, okay, I'm in, this is good, let's go. I'm clinically savvy. What else is there?
Oh, there's so much more, as we all know.
Right.
Anybody who's been in a practice understands that there are so many other things that you have to pay attention to. You have to understand how you're going to interact with your staff. How are you going to interact with your patients? How are you going to interact with the community? How are you going to interact with any of the referring doctors that you work with? All of those things are baked into what we call the philosophy of care of the practice itself. And there has to be compatibility between your personal philosophy of care and the practice's philosophy of care, because we all know what happens when there's not continuity there. The patients get unhappy and the staff is unhappy. And I'm telling you, when the patients and staff are unhappy, what happens?
Yeah, things just don't go as planned.
No, they do not.
But wait, you hear, and I constantly hear this from clinicians. No, I'm all about effective and quality care. I'm all about clinical excellence. Isn't that enough?
No, sir, it is not.
What changed? What changed?
When I think back to some of the most successful practices I've ever seen, they know how to form relationships. They know how to establish a relationship between themselves and the staff, or themselves and the patients. Some doctors who truly do not want to do this, and they're out there and it's fine. All they want to do is focus in on their clinical excellence. That's wonderful. They, the successful ones in private practice at least, have found ways to establish relationships with their staff so that their staff is the one who manages the relationship. So how important is it that you find, again, when you bring somebody into that practice, somebody who can relate with that staff member who is then going to relate to the patients.
Wow. When you talk about that the context of that, what are like the top 3 things, or what advice? What do people need to understand as they're engaging both I guess the person bringing in this new dentist or new member, and the person coming in and kind of evaluating whether or not they want to join that practice? What are the key things that you would share that people just need to know or should look at?
Rolando, I am so glad that you asked that. Because we have a whole, what we call evaluation checkoff list. So before you ever sign on the dotted line to join a practice, take a look at that practice. Walk in the door. Walk in the door while patients are being seen. What does that receptionist look like? What does that experience for the patients look like? What do the patients look like who are waiting for their appointments? Are they like this because they've been there so long? Or are they engaging with perhaps the receptionist and maybe they're having a conversation? So you can learn a lot just by walking in the front door. And what about number 2? Let's look at the schedule.
Number one, and how long do you do this? You walk in. So I'm coming in as a young dentist, or I'm a seasoned dentist. I sit there and I look at, I guess, the experience. What you're saying is because how many people, probably very few people do that. They come right in. I talk to you. You're the owner dentist. You give me all this cool stuff. And I go, yeah, I like you. Let's go. I love that. Take the time to kind of soak it and feel the environment. Is that what you're saying?
That's exactly what I'm saying. Thank you. You said it much more succinctly than I did. And I appreciate that.
All right. So what's number 2?
Number 2 is come on back and look at the schedule. Look at the schedule. Make sure that you are comfortable with the way the office runs. Again, some dentists want to come in and they want to start a procedure, do the middle of the procedure, and do the end of the procedure all in one sitting. And that's a wonderful thing. Some dentists want to run 3 or 4 different chairs, as well as check 2 hygiene appointments. That's also great. But you need to understand if you are capable and if that style fits you. Because we wouldn't want somebody who is really high-powered, high energy. I want to go, 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 go in a practice where they're going to be expected to sit still and see one patient and follow them from start to finish for perhaps a 3 or 4 hour block of time. It doesn't make sense. And obviously the other way wouldn't work either. So you need to make sure that you can handle the schedule and you understand how the office runs, because boy, can you learn a lot. If you're expected to run 3 chairs of treatment and 2 of hygiene, you know that your auxiliaries are doing the maximum allowable. And are you good with that?
Wow. And plus I'm thinking, and if when you walk in, it'll give you a sense for how organized the place is, what kind of resources are there. That's huge. Get an understanding of wow. All right. That's good. 3. Now you got me.
Number 3, pay attention. Pay attention to
2.
the way the doctor interacts with both the staff and the patients. This is why I think it's so important that when any dentist is evaluating any opportunity, they should walk in and be there during the time when patients are being seen in the office. Pay attention to the way the doctor interacts with the staff and the way the staff interacts with the patients and the doctor interacts with the patients. Make sure that that fits your personal style. And here's the pearl. You gotta go 3 times. 3 times. If it is at all possible. And why would you want to go 3 times? The first time, everybody's on their best behavior. Everybody's happy and showing off, right? We've got somebody new in the office. Let's make sure we're all on our best behavior. Second time, maybe a chink or 2. By the 3rd time you go in that office, you are going to see what's really going on.
I actually, number 3, I feel is the most. Go at least 3. You're right. When it's kind of like when you're engaging or interviewing or whatever. Best behavior. The place is clean. Everyone's and then as it goes through. So feel, walk in, observe. 2, And you got to be there. I love this. You got to be there when they're working, when they're busy, so that you can actually see this. 2, check the schedule, right? And then 3, I love it. 3 times, that's the pearl. So let me ask you this. Is this taught in dental school?
I
That
have
was a
been to
rhetorical
so
question.
many schools over the last 4 years. And I had the pleasure of working with senior dental students directly as the extramural rotation director at a public health clinic in my prior years. And I hear the same things over and over again. We have no idea. How do we know what the right practice is for me? How do I know what the right practice style is for me? How do I know what the right practice modality is? Because one size doesn't fit all. You have to understand what you want. And then you have to go find the place where you can become the dentist you always dreamed of. But you have to invest in yourself.
See, I love that. And it's not clinical expertise is key. You have to be clinically savvy. And my sense is the dental schools are phenomenal at doing that. What's cool is they're now incorporating an understanding of the business of dentistry and how to navigate through that. But this aspect is another dimension that you really don't hear much about. And it's interesting. What are some stories or what are some experiences that you can share of either successes or even more importantly, things that just went totally?
One of my favorite stories actually is a success story, although I can always share a good what went wrong. I'm good at that too.
Right.
One of our very first matches was a young lady who graduated from UNE and ended up in a very rural area in northern Maine. And she has done so well in that practice. She actually purchased it a year and a half after she joined. So a year and a half from graduation, she purchased $1 million practice and building. It was unbelievable. She is killing it. And if you ever want to talk to her, I'm happy to give you her name. She loves to talk about her experience using our service and how it's worked out for her.
What was it? What, if you could, or if you could share, what was the key thing that enabled her, and as important, the practice to kind of connect that way and resonate? What was that thing?
I would say it's the way that our service actually works. She filled out a profile that was pretty extensive. It asked a lot of things about her and her preferences. And the owner, conversely, had filled out a profile that told us a lot about him and what he was looking for.
So wait, so they both swiped right or left?
And then they did. I am telling you, when their profiles came across the board and I looked at these two, I just got cold chills because they matched up so well in so many areas. And she had very little intention of going to a rural area. And after they had a couple of conversations, the magic happened.
Funny how that happens, right?
It was a thing of beauty. And I've actually been up there. I was there for the ribbon cutting ceremony not that long ago. It was just, I have cold chills right now thinking about it. And it's not just because it was northern Maine and I was really cold.
So I love success stories. Share something that didn't quite go as well and kind of what happened there. I'm curious.
I have one of, there's one that kind of hurts a little bit. This wasn't one of it wasn't one of our clients, but you hear a lot of stories like this. This young lady graduated. She joined her aunt in a very highly producing practice. And they had a wonderful relationship. Everything was great. She oh yeah, I'm going to join this practice. She didn't really, it wasn't a good fit. And the expectations that the owner dentist had versus the expectations that this new dentist had they just weren't in alignment. The owner dentist was one who just adored dentistry, was one of those, oh gosh, I love being here 6 days a week. And I'm going to be here early in the morning and I'm going to stay till late at night. And did it because she genuinely loved dentistry. And the young lady coming in, again, was a wonderful dentist, but the expectation was a little bit different. She had a young family. She wasn't planning on being there 6 days a week. And anyway, it caused a lot of problems between the owner and now her niece. And unfortunately, that translated into some issues in the family. The young lady ended up leaving the practice, and it's just a sad story because it could have all been alleviated just by understanding, what do I really want? And what do you really want? Which is why we spend so much time with our clients talking about, what are your expectations?
Yeah,
Let's get that up front. There's no reason to not have those conversations.
it's amazing. It seems so simple, but it's also so complex. And when you map it out that way, hey, what are you looking for? What do I want? Do we align? If not, thank you very much. Or not. But why would you say people don't do that? I'm very curious. Why is that step like skipped, or why do people miss that?
The $1 million question. However, I do have a couple of thoughts on that. Number one, everybody's busy.
Yeah.
Everybody's busy, and it takes time, but you're investing in your future.
Yeah,
Why
it
wouldn't
takes
you
time.
take the time to invest in your future? The other thing that I think comes into play is that I'm a dentist, I can say it. We tend to be a little bit autocratic.
No.
No, I can say it.
Okay.
I mean, we
didn't
think
say it.
our
I
way
didn't
is
say
the
it.
best way. We think that we know everything about everything, and everybody else should just fall in line. Well, of course, this person wants what I have. What I have is perfect. I mean, isn't that the way it all goes? I mean, according to
Wait, no.
me.
I'm the only one who knows what's going on. Everybody else doesn't understand.
Exactly. But so dentists
Okay.
need to understand that they've got to take the time to invest in their futures. And part of investing in your future is really evaluating each situation to see, is this the right one for me? Whether you're hiring, whether you're selling, whether you're buying, whether you're joining.
No, I love that. And I love the context around it. It's amazing. There are, we work with a lot of clinicians, and one of them goes out, and especially when now I get the connection to when you're transitioning or if you're looking to sell your practice. If relationships haven't evolved to the point where you have meaningful, that a senior dentist is looking and they discover that their practice is not worth anywhere near, because they don't have the patient base, they don't have the morale that their team has, and then they're surprised that, wait, I've worked all my life, I'm an amazing clinician, but there was that one piece. It's, did you establish meaningful and deep relationships with your team, with your community, with your patients? And I get that. I've been a dentist who are phenomenal clinicians, but I go to a dentist who actually takes time to talk to me.
Yes. That's all I've got to say is
Right?
yes.
Right? So,
And, conversely, we've got some doctors who, perhaps their practice isn't quite worth what they thought it was, but the reason is that they've slowed down.
yeah.
They have decided that it's enough for them. And honestly, I don't have a problem with that as long as they understand the ramifications of making that decision. Again, it's all about what's right for you. I would never tell somebody that the way they're doing it is wrong. I just want everybody to understand the ramifications of making some types of decisions, like I'm going to slow down to 3 days a week. I'm going to choose to not collect all of what's owed to me. Those are two biggies that I see.
Right. And it's funny, again, it seems so simple when you lay it out that way, but when you're in the midst of it, it kind of becomes a little overwhelming. You get lost in it because you're, again, busy, no time. Let me ask you this. I've heard, and I'm going to put you on the spot here, the American Dental Association has been around for a long time. And I find, I talk to a lot of young dentists who are like, yeah, they're okay. I think they're missing a lot of things that the organization offers. What are some of those, and how can people find that out? What's a way that people can, because it sounds like this is an incredible resource that people can take advantage of. And I would suspect that not a lot of people know that it's even available. Yes?
Absolutely. This is only one of many, many programs that the American Dental Association is investing in. so that they can really show value to their members. And I just want dentists out there to know that the ADA really does have your back. I mean, from groundbreaking insurance legislation getting passed in Massachusetts to things like these programs, ADA Practice Transitions, which helps you at every single stage of your career. So any dentist who's asking, what is the ADA doing for me? What have you done for me lately?
Right.
I'm not going to break into song. They should go to ada.org and check it out, and check out ADA Practice Transitions if you're interested. And we've got so many free resources, and we just really want to help dentists to succeed at every stage.
So wait, free resources for members. That's a big deal.
Yes, sir. Lots of free resources for members.
So, I could spend, oh my goodness, I'd love to dig into that. But again, I really appreciate you taking the time, and the context around this relationship is huge. If you were to kind of take what we've talked about, sum up as what would the key message be for people watching this? What would that be? What's the advice that you would give them as they're entering into dentistry and looking to kind of transition between, school practices, different practices, group versus not? How would you sum that up?
I would sum it up by saying, take the time. Take the time to evaluate the situation that you're looking to get into, and decide whether you are going to learn to be the dentist you always wanted to become in that particular setting. For example, if you're looking to become an implant dentist, make sure that you're in a practice that they're placing implants. Right. Sounds very simple, right?
It does.
If you are very mission driven and you want to help the homeless population, then make sure that that particular practice is going to serve the Medicaid population. Whatever it is that you want to learn to become the dentist you always wanted to be, take the time to evaluate all modalities, and for you, not your peer, you.
I love that. So, hey, first of all, if everybody, Dr. Suzanne Ebert is the VP of Operations and Practice Relations at the American Dental Association. She's a busy lady, and she's taking the time. I love, in the interaction that I've had with her, I've had the opportunity to spend time. She knows a lot. She's been in practice. She's run multiple facilities. There's a wealth of knowledge and wisdom that she has, and she's got that and is willing to share that. If people wanted to contact you or reach you directly, what would be the best way to do that?
Email is probably the best way. Ebert, SEBERTS at ADA. And I would love to have a conversation with anybody. I love talking about dentistry. It's my passion.
Oh, I love it too. And if people have questions, ada.org.
Yes. So sorry.
And practice transitions, I believe, correct?
Yes. ADApracticetransitions.com is where you can learn all about this particular program.
Fantastic. Well, first of all, I so appreciate you taking the time to spend with us. I love hearing the success stories. We learn a lot when people don't get there, because it's like, oh my goodness, be mindful to do that. Your top 3, take the time, look at the schedule, right? Oh my goodness gracious. Those 2 things. And then here's the thing, alignment. It keeps coming across. It seems so simple. And we forget to do that. So anyway, Dr. Ebert, Dr. Suzanne, it's been a pleasure speaking with you. Really, really appreciate the time you spent here. I love the perspective. You clearly love what you're doing, and I'm excited that we got an opportunity to do this. Later on, would you like to join us back and maybe spend some time? Yeah?
I would love to. Thank you so much, Rolando. This has been so much fun.
Oh, no, this is awesome. Hey, everybody, if you like this content, please share. If you have questions, please reach out to Dr. Suzanne Ebert. Check out the American Dental Association. If you have questions for us or would like to see more of this, at Zyris and Dental Voice, please let us know. We've built this because we want to provide information for you. Check out Empowered Dentistry for more information. Dr. Ebert has actually posted some of her articles in there too. So look forward to hearing from you. Thank you, Dr. Ebert. If I don't talk to you, happy holidays. Have a wonderful time. It's great to see you. And thank you for joining us. Take care.